Tinnitus is a common condition frequently encountered in clinical practice. This mini lecture briefly reviews tinnitus from a traditional Chinese medicine perspective, focusing on acupuncture, herbal medicine, and evidence-informed clinical insights. Clinically, tinnitus manifests as a range of phantom sounds, ringing, buzzing, or humming, often accompanied by fluctuating hearing disturbances. Its severity is frequently aggravated by stress, significantly impacting patients' sleep quality and emotional well-being. Understanding these clinical features is crucial for effective intervention. Conventional approaches to tinnitus often face limitations, including chronic recurrences and the lack of definitive curative treatments. Management typically focuses on symptom relief with highly variable patient responses. This highlights the need for alternative and complementary strategies, which TCM offers through its holistic framework. From a TCM perspective, tinnitus reflects systemic imbalance rather than isolated auditory dysfunction. Clinically, presentations often involve liver-gallbladder fire, kidney deficiency, or internal wind. Shaoyang dysregulation and the disturbance of clear yang also play significant roles. Although systems manifest in the ear, treatment frequently emphasizes restoring systemic balance and regulating the lower aspects of the body. Our clinical approach to tinnitus in TCM centers on precise pattern differentiation to identify both the root cause and the presenting symptoms. Key strategies include regulating the Shaoyang meridian, clearing excess fat, and nourishing kidney essence. The ultimate goal is to restore overall systemic balance, addressing the underlying disharmonies contributing to tinnitus. Acupuncture offers a targeted strategy for tinnitus management. We aim to regulate the Shaoyang meridian, calm liver yang, and restore the ascent of clear yang. From a modern perspective, acupuncture may influence auditory pathway modulation and autonomic regulation, contributing to symptom regulation and functional improvement. To implement this strategy, we commonly utilize points such as Tinghui, gallbladder 2 for local air benefit, and Yifeng, Sanjiao 17 to clear heat and open the auditory orifices. Zhongzhu, Sanjiao 3 regulates the Shaoyang meridian, while Waiguan, Sanjiao 5 expels wind and harmonizes Shaoyang. Haixi, kidney 3 nourishes kidney yin, and Taichung, liver 3 soothes liver qi and subdues yang, reflecting classical TCM reasoning. Complementing acupuncture, herbal strategies may focus on clearing liver fat, nourishing liver yin, regulating Shaoyang, and calming internal wind. Based on pattern differentiation, Several representative herbal formulas may be considered. 龙胆泻肝汤 is commonly used for liver-gallbladder fire. 耳龙左慈丸 may be considered for kidney deficiency. 天麻钩藤饮 addresses liver wind and liver yang rising. 小柴胡汤 can be used to harmonize Shaoyang when appropriate. Modern research suggests that acupuncture and herbal medicine may influence auditory pathway modulation, autonomic regulation, neurovascular function, and stress response systems. Evidence-based support for TCM in tinnitus is growing. Systemic reviews and clinical studies indicate its potential efficacy. This accumulating body of evidence signals an emerging recognition of TCM modalities within evidence-informed practice and broader clinical integration. In traditional Chinese medicine, tinnitus reflects systemic imbalance rather than isolated auditory dysfunction. Management is based on precise pattern differentiation, with acupuncture and herbal medicine applied as targeted interventions. Evidence from clinical studies supports the potential role of these approaches in tinnitus management. Thank you for watching.